Education has been a primary focus of my career, and it is the aspect of my job that I actually like the most.
Well, I think this is a really great place to train. You know, we have engaged faculty. We have people who are really experts in their field. You're going to learn more here than just about any place else, just because of the quality of the faculty that we have.
We're highly invested in your education and love to teach at the scope, through formal lectures and unknown conferences. And anytime there's an interesting case, we're always here to show it around.
I really enjoy working with the residents here and seeing how they mature through the system and how much they learn and the autonomy that they get with our program.
I absolutely love interacting with an eager, curious learner who often, the first time they come into our blood bank, they don't know anything about blood banking.
It's really how we share information. Each of us comes with a different perspective, and putting all of our ideas together as we talk about different cases is really a fun part of the training and interacting with the residents and the fellows.
What a diversity of material. You know, patients have the most broad and unusual things, from the most common, simple things to some of the most complex diseases and specimens that you can even imagine. And it is all here at Vanderbilt University.
You really have a wide range of settings to study and practice in. The Vanderbilt Main Hospital is a major academic tertiary care site where you're seeing the most complex cases from regional hospitals being brought in here for us to come to a correct diagnosis and assist clinical teams in curing patients. At the same time, you have a children's rotation in a children's hospital that's dedicated to state-of-the-art pathology and helping to do the same thing in a pediatric population. And then you can walk 5 minutes across the quad and get to the Veterans Administration, where you are seeing more of the types of cases that you would expect to see in a complex general practice.
All of our rotations offer graduated responsibilities for our trainees. The residents and fellows learn to present the cases, they answer the clinical questions, and they are really a pivotal part of the diagnostic team.
As we ask you to look at these things as a trainee and provide you the instruction, we try to do it in a way that really is planned and really makes sense for your time. One of the major efforts we've done across the entire department in order to try to improve the quality of resident training and to make them more efficient with their time is this process of the Diagnostic Management Team, or the DMT.
The Diagnostic Management Team is a program that we use to sort of change the paradigm of what pathologists and laboratories do and the way that we function in a medical center. But in reality, testing starts a long time before a specimen arrives in the laboratory, and it ends a long time after the result is reported. We hope that by participating in the Diagnostic Management Team, our residents really learn hematopathology and coagulation and microbiology and transfusion medicine and clinical chemistry better, because it's a case-based approach where they really think about the utility of testing. What is this test? What is it for? How do we use it? When we get the results back, what do they mean? It's a really good, comprehensive way for our residents to learn not only the subject matter, but also to learn how to practice pathology in the 21st century.
And so one of the things that I think is a newer development that is actually really quite potent when used properly is the idea of milestone-based training. So instead of asking someone to evaluate you from a level of 1 to 5, how was your medical knowledge on this rotation, we can say, on this rotation, did the trainee demonstrate medical knowledge with the following ways? Did they come to sign out prepared with knowledge of the average case? Did they come to sign out prepared with knowledge of very difficult cases? Had they clearly read deeply about unusual cases that would be a challenge to anyone? And so the idea would be that with well-written milestones and with an appropriate type of feedback, you can say, I was at milestone level 2, which is great because I'm a new resident. If I want to be to milestone level 3 in this particular area, then what I need to do is anchor myself to those milestones. I need to start reading more deeply about my cases. I need to develop the ability to manage my time and get through my average cases so I have time to spend more time on the more difficult cases.
High volume, high complexity, and a lot of responsibility for our residents, and particularly for our fellows, in terms of coordinating patient care and communicating with everybody all along.
I think this program is one that really prepares the residents and fellows for what lies ahead.
The best feeling is when you get a call or an email or a text from a trainee that's passed through the program and they're just saying thank you for this great training. There's nothing better than that.
So we're really looking for residents who are excited about the field of pathology, who are really driven by a desire to know more, to learn more, to want to really engage in the process of learning. And I think if you're that type of person, then this is a place where you could really be successful.
And most importantly, we want to produce pathologists that are a comprehensive part of a multidisciplinary team with the patient at the focus.
What we are looking for in residents and fellows are physicians who are enthusiastic, curious, and hardworking. And with the patient material that we have here and the excellent faculty, we think that this is just the place that can help you develop into the best physician that you can be.